Hi, I'm Sam.
And I'm Sarah.
We're here for the McGill Eating Disorder Program to talk about signs and symptoms of eating disorders.
In a culture obsessed with ideal body images, thinness, and dieting, it often can be hard to recognize when someone's thinking or behavior has crossed into dangerous territory, putting them at mental and physical risk. Today, we want to discuss the signs and symptoms of commonly diagnosed eating disorders and hope that this video will be a helpful tool for anyone looking for more information about eating disorder awareness.
Eating disorders are extreme expressions of a range of food and weight issues experienced by both men and women, and with the number of people diagnosed with eating disorders rising, it is possible that you, a loved one, or someone you know may show some of the following signs and symptoms associated with commonly diagnosed eating disorders.
Eating disorders include anorexia nervosa, bulimia nervosa, and eating disorders not otherwise specified, also known as EDNOS, which includes binge eating disorder. So, what are some general warning signs? A marked increase or decrease in weight not connected to a medical condition. The development of abnormal eating habits such as severe dieting, preference for strange foods, withdrawn or ritualized behavior at mealtime, or secretive binging. An intense preoccupation with weight and body image. Compulsive or excess exercise, and feelings of isolation or depression.
Anorexia nervosa is primarily characterized by self-starvation and excessive weight loss. A person with anorexia is thin and continues to get thinner, diets even though they are not overweight, will starve or go on cleanses or fasts, has a distorted body image, feeling fat even when they are not, loses or experiences thinning hair, talks excessively about dieting, cooking, weight, or food, and for women, the loss of 3 consecutive menstrual cycles.
Bulimia nervosa is characterized primarily by a secretive cycle of binge eating, eating to the point of feeling sick or overly full, followed by purging. A person with bulimia engages in binge eating disorder, uses the bathroom frequently, even after meals, and might find excuses to leave the table. They may react to stress by overeating, feels out of control during a binge episode, purges after a binge episode, and purging can involve vomiting, use of laxatives, diet pills, diuretics, excessive exercise, or fasting. Experiences frequent fluctuations in weight, diets, obsessing about body, shape, and size, and has depressive moods.
Eating disorder not otherwise specified includes eating disorders that do not fit the criteria of anorexia and bulimia. A person with EDNOS might struggle with body image, restrict their diet, binges, exercises, and/or diets excessively. Although it should be mentioned that a person with EDNOS might exhibit one or more of the mentioned characteristics, but not necessarily all of them together, and do not meet all the necessary characteristics for a diagnosis as anorexic or bulimic.
Binge eating disorder is included in the EDNOS category. One may identify a case of binge eating disorder if it involves periods of gorging or excessive eating. There is no purging involved in binge eating disorder. However, there may be fasting or repetitive dieting involved. Someone with binge eating disorder may have a body weight that constantly fluctuates, eats large amounts of foods even when not hungry, eats rapidly, eats to the point of feeling uncomfortably full, frequently eats alone due to shame, hoards food, has depression or anxiety, and feels that their eating behavior is out of control.
Please note that there are many people with some form of disordered eating that does not fall under one of these categories. For more information on signs and symptoms or eating disorders in general, please check us out at the link provided at the bottom of the video.